you. Good afternoon. This is Barbara Seidel. I'm the Chief Operating Officer of the Union for Reform Judaism, and we're thrilled to welcome you this afternoon to our first webinar about compliance with the Affordable Care Act. And we have 4 panelists today that I'd like to introduce to you. Our first is Scott Bellin, who's an account executive at Alliant Employee Benefits. Partnering with Scott is Jennifer Mills, who's a board member of one of our congregations and is a partner in the employee benefits group at Baker Hostetler, which is a major law firm. Also, co-hosting our webinar this afternoon is our HR director at the union, Stephanie Jarrett, and Amy Ogle, who's the Congregational Network Director for the Central District. Amy also has a background in HR, and she and Stephanie have been working with Jennifer and Scott for several months to prepare this material. And I'll turn it over to the panel.
Thank you, Barbara. This is Stephanie Jarrett, and before we begin, just a few words about who we are. As employers, we have responsibilities under the Affordable Care Act, but as a Jewish community, we have even greater responsibilities to one another. Through the Affordable Care Act, everyone will now have access to affordable health care. Today's presentation, as Barbara said, is our first webinar on the Affordable Care Act. Our goal is to have you walk away with a 30,000-foot overview of the Act, not a deep dive, but to have a better understanding of the Act and the necessary next steps you will need to take. We are honored to have a diverse group of congregations and their professionals with us this afternoon. Many of you will need more information according to your congregational needs, and we will be happy to host a second webinar that will provide you with a deeper dive into more of the nuts and bolts and other pieces of information you're going to need to know in January 2014. So with that, I'm happy to present Scott Bellin, who will begin our presentation.
Thank you, Stephanie, and welcome everybody to our webinar. So what we're going to talk about today is called the Patient Protection and Affordable Care Act, known as PPACA, or many people call it Obamacare. This act was put into place in 2010, and even today in 2014, it's still changing, evolving. Every day is different. So some of the things we're going to cover on today's agenda, we're going to, illustrate whether, tools for you to figure out, are you a large employer, large congregation, or small employer, small congregation. And we're going to talk about how the Affordable Care Act impacts large employers. We're going to talk about how it impacts small employers. We're going to review the individual mandate, which is probably the biggest thing that comes out of this healthcare reform, and we'll talk about that. We're going to talk about fees and penalties associated with large employers, individual mandates, et cetera. And we're going to just, guide you on the next steps that you're going to need to take once you hear this information. Okay, so if the Affordable Care Act, from different employers, they're going to be looking at it differently. So some 3 considerations that are going to be key is, in regards to the employer mandate, is figuring out, are you a large employer? Will the large employer mandate affect you? Generally, a large employer is an employer that has 50 or more full-time equivalent employees, and we're going to show you how to compute that. A small employer is going to be somebody who has less than 50 full-time employee equivalents. We're going to talk about the individual mandate, who's subject to it, what it means, and we're also going to review the employer's choices of what they're going to have to do, how they can buy their health care, whether it's through the exchanges, the public exchanges, private exchanges, through the insurance carriers, et cetera. Okay, I'm going to hand this back over to Stephanie.
Thanks, Scott. Before we go any further, we thought it was really important for us to remember, for the purposes of this presentation this afternoon, that when we refer to a small employer and when we refer to a large employer, we will be referring to that definition according to the definition of the Affordable Care Act, not the internal definition or the URJ classification of what is a small and large employer. As we just learned from Scott, the Affordable Care Act defines an employer according to the employee count. Thank you, Scott. And Jennifer, will you continue for us, please?
Yes, thanks, Stephanie. And one of the points that we have just started to illustrate is one of the key things in understanding the Affordable Care Act is understanding the definitions under the Affordable Care Act. Large employer, small employer. And whereas Scott and Stephanie have provided an overview of the Affordable Care Act up until this point, now we need to dive into some of the mechanics of how it works, these new definitions, and how these things impact congregations in their roles as employers. The first thing that a congregation needs to understand is it an applicable large employer under the Affordable Care Act? An applicable large employer is an employer who averaged at least 50 full-time equivalent employees per business day in the preceding plan year. So for purposes of determining whether the employer mandate is going to apply to you in 2014, you're going to be looking at your 2013 numbers. In looking at whether you're an applicable large employer, it's important for a congregation to think of all entities under its control. This is obviously your clergy and your staff, but also your religious school staff, preschool, tutors for bar and b'nai mitzvah. All of these employees of the congregation who fall under this common control all have to be considered in determining whether you're an applicable large employer. In addition, all types of organizations are subject to the requirements of the Affordable Care Act: for-profit, nonprofit, the congregations, and governmental employers. So to determine if you're an applicable large employer, you have to look at the average full-time employees that the employer, the congregation, had, and these are employees who work 30 hours more per week, and then you have to add in full-time equivalent employees. And this is the part-time variable hour workforce that congregation may have. Your religious school teachers, your librarian, all of these have to go into this equation. A full-time equivalent is equal to 120 hours per month worked by part-time variable hour employees. And I'm going to go through an example of this in a moment. So you're going to take all your actual full-time employees, those working 30 hours or more a week, and then add to them for every month the full-time equivalents based on averaging all the hours of your part-time workforce. And that's going to give you the number to determine if you have 50 full-time equivalents and are subject to the employer mandate. Thanks, Scott. Determining if you're an applicable large employer. I'm going to use an example here that may apply to many congregations, and we'll just walk through these steps, and if it all makes sense, hopefully they'll make more sense to you after that. Let's say you're a congregation that has 35 full-time employees. Those employees are actually working 40 hours a week. They're your 9-to-5 employees per each month of the prior year. Then you also have 40-plus part-time employees who work on average altogether 2,000 hours per month. For all of those part-time employees, those working less than 30 hours a month, you have to take their total number of hours per month, divide by 120 hours, which is a number geared under the Affordable Care Act, to come up with your full-time equivalent. So in this example, you have 35 employees who are full-time on their own. You have 16.67 full-time equivalent employees. That's putting all your part-time employees together and figuring out what the equivalent full-time employees are. And that gives you a number of 51.67 full-time equivalent employees. Because you've surpassed that number of 50 full-time equivalents, you are an applicable large employer under the Affordable Care Act, and you now have to offer health insurance or consider paying penalties if you don't offer health insurance to all your employees. If you fall under this 50 full-time equivalent threshold, you are not required under the employer mandate to offer health insurance to your employees. It's important to note that this is, as Stephanie said, a 30,000 feet in the air presentation, and there are some special rules under these determinations of who is an applicable large employer, such as for seasonal employees. You may have summer programs, so how all those employees fall into this needs to be considered too. So, and we're going to go to the next slide. So what does it mean if you're an applicable large employer? It means that you could face possible penalties. You have to make the decision of whether you're going to pay penalties or play and offer health insurance in 2014 under the Affordable Care Act. So if you are an applicable large employer, what does this mean? It means your congregation must make a decision whether to pay or play. And it's important to note that the penalties are only going to apply if you have employees who go to the public health insurance exchanges and get subsidized coverage, which we're going to talk about more in a few minutes. So let's say you're an applicable large employer and you have 50, therefore you have 50 full-time equivalents per month, and you have to offer health insurance coverage. If you do not offer minimum essential coverage to all of your employees, you are going to pay a penalty that is equal to $2,000 times the number of full-time employees. This is just the actual full-time employees that you have. We're not worried about the part-time employees and those equivalencies anymore. That's just for the threshold question of, are you an applicable large employer? So you're going to pay a penalty of $2,000 times the number of full-time employees that you have over 30. So that's one of the penalties that can come into play. However, some employers might offer health insurance to all of their employees, but under the Affordable Care Act, it may not be deemed affordable for those employees, or it may not offer a minimum level of coverage. So there's another way a penalty could apply to your congregation. If you offer health insurance, but it is neither affordable or doesn't provide the minimum value level, that 60% threshold, then you could pay a penalty. But this is a per head penalty for every employee that you have that goes to the exchange and gets subsidized coverage because your coverage wasn't comprehensive enough and that did not provide 60% of benefits or was unaffordable. The question of whether insurance is affordable that you offer to your employees is based on the cost to the employee. If it is more than 9.5% of their income, then it would be deemed unaffordable, and then therefore they'd be able to go to the exchanges and get subsidized coverage. If your coverage is affordable and it has that minimum value and they go to the exchange, then they're not going to be able to get subsidized coverage and you wouldn't have a penalty. So it's important to understand that concept. Is the coverage cost to the employee then less than 9.5% of their income? And this is just the employee-only coverage. If the coverage for a family or employee plus spouse, et cetera, is more than 9.5%, that doesn't matter with the affordability equation. The only thing that matters is the cost for individual-only coverage has to be less than 9.5% of the employee's income. At this point, I'd like to move to the next slide, and this slide is a comprehensive slide with lots of information. It's an overview of how the exchanges work, how it's going to matter to employers, to individuals, and we're certainly not going to go through all the details of this slide, but it does show the mechanics of the exchange and how it impacts an employer, and it's key that a congregation understand the exchanges for several reasons. First, the exchanges are a new marketplace where both employees and possibly employers, such as congregations, can purchase insurance. Second, congregations, as employers, are going to have to educate their employees about the exchanges in the form of a health insurance exchange notice that is going to be sent out to all employees by October 1st, 2013. And this is regardless of whether you offer insurance or don't offer insurance to your employees. Third, your employees are going to be subject to an individual mandate that we'll discuss in a little bit, and they may need to purchase insurance somewhere if you don't offer coverage or don't offer affordable coverage. And I'd like to just walk through a quick example of how this slide works and how an employer could use it to understand the mandate. Basically, you are eligible for subsidized coverage under the health insurance exchanges if your income is between 100% and 400% of the federal poverty level. So for a family of four, 400% of the federal poverty level is $92,200. If you as a congregation offer health insurance to your employees, but it is unaffordable, i.e. the cost of individual coverage is more than 9.5% that employee could go to the exchange and if they have a family of 4 and their income is less than $92,200, they could purchase subsidized coverage. If they do that, even though you offer health insurance coverage, because it's not affordable, the congregation could be subject to a penalty of $3,000. So, but if you do offer affordable coverage, then that individual would not be eligible for subsidized coverage, and you wouldn't have to worry about the penalties. So, how employers offer coverage, and how the exchanges are going to be working for the first time in 2014 are key to understand. With that, I will turn it over to Scott, who's going to talk about who must be offered coverage for applicable large employers.
Okay, for applicable large employers, who must be offered coverage? Employees who are expected to work full-time, which is 30 or more hours a week, must be offered coverage within 90 days of employment. So if you're an employer right now that has a medical insurance contract that allows employees to enroll first of the month following 90 days, you would need to change that provision. So coverage needs to be available on that 91st day. Okay. Coverage must be employee and dependent. Doesn't have to be spouse. Obviously, most employers do offer spouse. But the cost factor, that 9.5% that Jen mentioned before, is only for single coverage. If you offer coverage to the dependents and the spouses, the Affordable Care Act doesn't dictate what you can charge them. So you could charge them the full price if you wanted to. Other employees, part-time, seasonal, variable hour employees, to determine whether you have to offer them coverage, we're going to talk about a look-back period or look-back determination on the next slide that Jen will talk about. And also, when you have these part-time, seasonal, variable hour employees, you must either have a record of their hours worked, so you have to maintain that information, or use equivalency based on days or weeks worked. So you need to track the employees. So Jen's going to now talk about determining who is full-time and if they're entitled to coverage.
All right, thanks, Scott. Obviously, not all employees of every congregation are going to fit squarely into the full-time employee status, i.e. under Affordable Care Act, working 30 hours or more per week. Therefore, variable hour employees, part-time employees are going to need to be given special treatment in determining how they fall under the Affordable Care Act. Essentially, congregations can use a look-back determination, kind of a historical look-back at how many hours an employee worked to determine whether they're going to be a full-time or part-time employee under the Affordable Care Act and therefore must be offered coverage. If you're working 30 more hours a week, you need to be offered coverage under the Affordable Care Act. If you're part-time, less than 30 hours, you do not have to be offered health insurance. So what the variable hour employees need to have done with them is there has to be a look-back determination. You look back over a period of months, anywhere from 3 to 12 months, and you look at the average number of hours that those employees worked. Then, and during this time, they do not have to be offered health insurance so long as when they were hired, the intent was not that they would work 30 hours or more per week. Once you have this measurement period, the congregation then has a short administrative period to figure out and determine what was the average number of hours. And then if it is determined that they worked 30 or more hours per week on average during that historical measurement period, the employee must then be offered health insurance for a stability period, a going forward period of at least 6 months, but not less than whatever the measurement period was. So you essentially you can look back and see what historically the employee did, and then you have to make them equivalent to what they were historically on a going forward basis, the stability period. I think everybody who has been writing these regulations realizes that there is a lot of complexity within this arena, and therefore there is a 95% safe harbor rule. So long as you're offering insurance to 95% of those employees, so you're not leaving out more than 5% or the lesser of 5% or 5 employees, there is a safe harbor that you may not be subject to the penalties with regard to this, realizing the complexity of this area to employers at this point. But for those employees who are not true full-time employees, you have to look at these variable hour employee rules. with that, I think we were going to take a moment to see if there were any questions that we wanted to answer at this point. And Amy, I will turn it over to you.
The one question that I think is gotten in a couple of different ways is understanding that we have to use the full-time equivalents for determining who, how many employees you have. Do congregations have to offer health insurance coverage to their part-time employees? And if they don't, then how do those part-time employees get insurance?
I'll jump in on that question. Part-time employees, most insurance carriers will determine anyone who works under 20 hours part-time. So that's going to be really up to the congregation and their insurance carrier to decide whether you don't have to offer it between 20 and 30, but if you want to, you should be able to offer it down to 20 hours.
But and just following up on Scott's point, for purposes purely of the Affordable Care Act, the penalties are only going to apply, taxes penalties are only going to apply to the extent that you're not offering coverage to your full-time employees, which is 30 hours or more. So for purposes of the employer mandate, we're only worried about those working 30 hours or more, or with regard to this look-back period I just talked about, averaging 30 hours or more after a measurement period.
And I think the follow-up to the question was, if somebody's part-time, then they can go to the exchanges on January 1st, and they can buy coverage from the exchanges, either the public or the private exchanges.
Right.
Amy,
is there another question?
No, that covers the questions we've gotten thus far. Oh, well, wait. The question is, most teachers have a contract for the school year, and I assume we must now track their hours in addition to the teaching contract terms.
You should be tracking. I mean, another part of this, and Scott, and we've talked about this, is that you really need to be tracking all of your employees' hours, and there's some special rules for teachers who work, 9 months a year, and how all of that is determined. So this is kind of a big, broad review, but there are some special rules for different categories of employers that you would want to pay attention to. Scott, do you have anything else, sir?
No, you hit that on that. That was good.
And there is another question regarding penalties, and we will be covering the penalties a little bit later in the webinar. So let's go on, and we'll have another opportunity to ask questions.
Okay. Now we talked about the large employer, the applicable large employer. So we're going to move on now to the small employers, because as we mentioned before, there's different provisions. The large employers need to offer benefits. So the question is, now if you've determined yourself to be a small employer, less than 50 full-time equivalents, okay, what does it mean for you? You are not subject to the large employer penalties or mandates, which means if you have under 50 full-time equivalents, you do not have to offer benefits. Really straightforward. You're not subject to the penalties at $3,000 or $2,000. So there's no financial burden on that aspect. Now, being a small employer, if you currently have coverage, you can continue that coverage that you either went through a broker or went to an insurance company. You'll also have the availability to go to the exchanges. There's going to be two types of exchanges. One is the public exchange. That's either offered by your state, or if your state doesn't offer a public exchange, it would be run by the federal government, or there'll be private exchanges. Private exchanges will be run by insurance companies, by insurance brokers, by other different types of companies where you can go and buy this type of benefit. Okay, public exchanges will be available with up to 50, for groups up to 50 or 100 employees, but that's going to be dependent on the state which you reside. Now, both small and large employers do need to notify their employees by October 1st of this year and let them know that the exchanges exist. And there are two model notices that we have the links here that you can get, similar to a COBRA notice. In fact, it's a model notice put out by the government. And one is a notice that if you currently offer health insurance, you would distribute the first notice that's here. If you do not offer benefits, you would utilize the second one. Okay, I'm going to pass it on to Jenny. Jenny's going to talk about the small business tax credits.
All right, thank you, Scott. The small business tax credit, and we're talking about a tax credit, so typically a non-taxable entity wouldn't think it would apply to them, but a 50C3 organization is eligible for this tax credit, and it's really key to note that it is applied against payroll taxes. So this might apply and be available to many of the smaller congregations on this phone call. It's an applicable tax credit. The percentages in Phase 1, which is 2010, so it's already been in play. It was one of the first provisions that applied to employers under the Affordable Care Act. Phase 1 is 2010 to 2013, and then Phase 2 is 2014 and thereafter. It's 25% and then 35%. It should be noted that this has gotten some play in the past few months with a sequester. There is a small potential for a sequester reduction under this of up to 8.7%. However, that is temporary. So it is still out. The small business tax credit is still out there. Basically, the small business tax credit is eligible. The general eligibility requirements are for a congregation that doesn't have more than 25 full-time equivalent employees. And once again, this full-time equivalent is calculated in a manner similar to the way you determine the full-time equivalent for the actual large employer. If you cannot have more than $50,000 in average annual wages, and you must make non-elective contributions toward each covered employee's health insurance at a uniform rate of not less than 50%. For the first phase of the small business tax credit, you have to purchase health insurance within the meaning of Section 9832, which is essentially it's insurance that's licensed in your state. During the second phase, 2014 and after, you have to purchase health insurance through a state exchange. That's one of the public exchanges. And there's an overall limitation for Phase 2 only that's available for 2 consecutive tax years, beginning with the first year in which the employer offers one or more qualified health plans through an exchange. So these are some of the technical requirements with regard to that. The tax credit is essentially 35%, the first phase is 35% of the lesser of the employer's contribution to employees' health insurance premium, or what the employer would have contributed if employees described above had enrolled in a plan with average premium as determined by the Secretary of HHS. In Phase 2, the amount increases to 50%. However, the contribution has to be to the employee's health insurance premium for qualified health plan coverage offered through an exchange. So you have the exchange requirement in 2014 and thereafter. The key things with regard to this is that it phases out, and it phases out quickly. The full credit is available if you have less than 10 full-time equivalent employees who with average comp of less than $25,000. It begins to phase out, and it phases out completely when you have 25 full-time equivalent employees or average compensation of more than $50,000. So this is just an overview of this because there is thoughts that it might apply to some of the smaller congregations. However, any questions regarding the small business tax credit should really be directed toward your tax consultant. And Scott, let's move to the individual mandate.
Scott,
actually, no, I think we're going to stop for some questions right now.
Oh, I'm sorry.
yes. Amy, do you want to take some of the questions?
Sure. One question is if employees who are minors are covered by their parents, are they included in this mandate?
Yes, they are. They're considered employees, but they don't have to take the benefits. They would just waive out of the benefits.
Okay. And then the exchange templates, this notification that has to be sent out, does it have to be sent out to all employees, even part-time employees?
Yes.
Okay. And then if a small group offers coverage, does it need to meet any minimum values and any of the affordability tests?
If it has less than 50 full-time equivalents, it is not going to be subject to the employer mandate penalties. So no, it wouldn't have to meet any of those requirements. Todd, can
And on the insurance, right? And on the insurance side, I would be very hard pressed if any insurance carrier is going to offer a benefit that's going to be less than the minimum value.
Right. Those are our questions up to this point.
There's one more question regarding a penalty that I thought maybe we could get clarification on. It was, what was the penalty of $3,000 for? Just wanted clarification on that.
The penalty of $3,000 is for an employer. Say you're an Apple large employer, so you've met that 50 full-time equivalent gatekeeping part, so you have to offer health insurance. And you do offer health insurance to your employees, and it meets that 60% threshold that we were just talking about. It covers 60% actuarially of all expenses. But for that employee, the cost is higher, and so then 9.5% of their income, so it would be deemed unaffordable for that employee. In that case, that employee could go to the exchange and purchase subsidized coverage, assuming their income is, exchange eligible based on that chart we gave you. In that case, the employer would have to pay a penalty of $3,000 because they had an employee who had coverage offered to them, but it wasn't affordable, more than 9.5% for single coverage of their income, and they went to the exchange and got subsidized coverage. You have to have all those pieces of play. It has to be unaffordable based on the employee's income, and the employee goes to the exchange and qualifies for subsidized coverage. That's when the $3,000 penalty comes into play.
Great. Thank you, Jennifer. Scott?
Actually, Jennifer's handling the individual mandate.
Great.
Okay. Thanks. Okay, the individual mandate is the third piece of the Affordable Care Act. And basically, we've talked about the employer mandate, we've talked about the exchanges and how those work, but really probably the biggest push in requiring everybody to, all individuals to participate in the healthcare system is the individual mandate. Basically, under the individual mandate, all individuals have to either buy coverage or pay a tax, a penalty. Parents would have to pay it on behalf of their children. Lower income individuals receive a pass on this because of other coverages that may be available to them and based on their lower income. But essentially everybody has to have health insurance come in 2014 or face the individual mandate penalty. Currently, the tax is going to be nominal, $95 per person, up to 3 family members, so a family could pay $285, or more or less 1% of taxable income over the filing thresholds, which are $10,000 for individual, $20,000 for a family. So you'd have to pay 1% of taxable income over those thresholds. So this is really the push to get everybody into the healthcare system. Employers, if they don't offer health insurance, may have to face penalties. The exchanges are going to have to offer health insurance to everybody, but it really falls to the individuals. All individuals are either going to have to enroll in health insurance or pay penalties. And this is important for congregations to understand because now they're going to have to, they're going to have employees who the first time are going to need to have health insurance to avoid penalties. It really works as a motivational tool in future years as these can go up, as the penalties will go up as income rises. So understand the individual mandate and why your employees are going to want health insurance for additional reasons in 2014 is key to understanding the Affordable Care Act. And Scott, you're going to look at the new fees?
Yep, and talking, now that we talked about the individual mandates, we talked about the large group, we talked about the small group. Now we're going to talk about some other fees and taxes that are going into effect. They're going into effect on, most of them are on January 1st, 2014, but a lot of them are already being built into the health insurance. If you already have health insurance and you're starting to renew your plans now, these fees and taxes are already being built in. Okay. One is called the PCORI, or the Patient-Centered Outcome Research Fee. That's paid by the plan sponsor, a reinsurance fee is paid by the plan. And if you're a fully insured program, which means you go to the insurance company and you buy an insurance product, okay, the insurance companies are paying this for you, but it is included in their premiums, okay? These taxes and fees are averaging about 2 to 4% of the gross premium. So just expect whatever you've been getting for renewals historically, now they may be a little higher because of these taxes. And again, these are built into the rates for a fully insured plan. If you're a large congregation, large employer, and you have a self-insured plan, which is a plan where you're basically paying the claims as they come in, you're going to be responsible for paying these fees and taxes directly. It's not going to be built into an insured product. Okay, and now we're going to switch over just to kind of give you a broad overview of where we were. I'm not going to go through every single bullet point on this timeline, but I just want to to understand PPACA, or healthcare reform, went into effect September 23rd, 2010. A couple of things that have already been built into the programs that most people look as positives are that dependents are now covered through the age of 25. Preventive care is covered at 100%. In 2012, plans renewed after 2012, there was something called the Summary of Benefits and Coverage, also known as an SBC. Okay, it's a uniform document for all the insurance companies. They all look the same with the same fonts and the same colors that list a specific amount of benefits that that are offered in the plan. The government put these in there so they all look alike. So any plans that are renewing now, you should be getting these from your insurance carrier. You will need to give them to your employees at open enrollment and to all your new employees. Okay, another item, if you have more than 200, if you distribute more than 250 W-2s, okay, the cost of the health insurance now needs to be included in that. For 2013, as we mentioned, October 1st, by October 1st, you have to submit to your employees the notice of the exchanges. Okay, we talked about for 2014, we talked about the fees, we talked about the essential benefits, we talked about the pay or play mandates for large groups. There are a couple of things that are still out there for employers, large employers who have more than 200 employees. Automatic enrollment, okay, it was originally supposed to be in 2013, then it got pushed off to 2014. It could be 2015. And what automatic enrollment is if you have more than 200 employees, you automatically enroll people into a benefit unless they choose to not enroll. Okay. Also, non-discrimination testing is going to be out there, and what that really is looking at your plans and making sure that all your effective dates are the same for all your different types of employees, that your contributions are going to be the same for all the same classes of employees. You can't discriminate against people and charge different amounts, on an arbitrary basis. And also, down the line, I know it's 2018, something that people need to be aware of, coming down, still 5 or 6 years away, is called a Cadillac tax. There'll be a tax assessed to plans that are too rich. So just understand that's 2018. We're looking at a presidential election away, and as I mentioned, first thing, things are still changing. That may or may not stay the same, but it is definitely still out there. Because that really covers the timeline of where we were, where we're going, and now Stephanie's going to talk about the next steps that you need to consider.
Thank you, Scott. Before we take any more questions, so please send them in if you have additional questions, we wanted to talk a little about next steps. So now that we have spent some time together today, we hope that you have begun to understand where you fall in this threshold. You need to understand and determine if you are a large employer or a small employer. You need to understand if you are eligible for the small business tax credit, and you need to understand how you and your employees may use the exchanges. We know that this is very complicated and that you will need additional assistance or guidance, and we recommend, in addition to a follow-up webinar that the URJ will do, that you contact your individual or local insurance professionals attorneys, accountants, and or tax experts for specific guidance that you may need regarding your own individual congregation. In addition to that, we have posted for your reference some links that we have found to be helpful, so please take advantage of this information. And that wraps up our presentation for today. I do see a few more questions have come in. Amy, can you field them for us, please?
Sure. I think here's a really great question, and it goes back to what Scott was talking about earlier with respect to the reinsurance fees and additional fees under insurance plans. Are insurance premiums going to go up abnormally once these new fees are put into place? And how do congregations need to be prepared with respect to renewals in 2014 and what they may be looking at in terms of the percentage increases?
I definitely can take this question, and the question is actually a two-part question because it really will depend on the size of your group. You know, we're based in New York. We have something called community rating that if your employer's under 50. And when you're looking at that market, and in most states there are community rating where it's either rated as a whole, you know, as a whole entity or based on individual employees. I know that's going a little deeper. On the small group market, from what we're hearing, you're going to see, I would think, for 2014, some abnormally high increases. That is what we're hearing, and especially in the New York marketplace. In regards to groups that are 50 to 100, the renewals, you're going to definitely see a little bit higher because of those taxes, because those size employers are usually rated based on their demographics, or what we call filed rates. And groups that are over 100 are primarily rated based on mostly their experience and part of their demographics. So if their experience is running well, you know, they could get a good renewal. If experience is running poor, they could get a high renewal. And then whatever those renewals are, you're going to see that 2 to 4% increase. I mean, medical trend, which is medical and health with medical insurance, medical inflation, which really dictates everything across the board, has been fairly steady at between 11 and 15% the last few years. So if you take that number and then add on 2 to 4% of taxes, that's kind of where you're going to be looking. I mean, in the small group marketplace, you're going to be competing, the insurance carriers are going to be, you know, competing with these exchanges. So I hope I answered that question. It was kind of a long question, but it's many different tentacles.
Thanks, Scott. You mentioned special rules for teachers, and could you elaborate on those a little bit?
Jen, that's, I believe, your question.
Yes, I'll take that one. If you have, and I know that congregations can have all different types of teachers. They could have full-time preschool teachers who really are full-time 30 to 40 hours a week. They might have religious school teachers who are working 4 or 5 hours a week. If you truly have teachers who, and then those preschool teachers might take 3 months off during the summer. If you have, the easy one on this is a teacher who no matter what always works 4 or 5 hours a week year-round or 9 months a year. They're never going to get near that 30 hours of full-time equivalency. With regard to the preschool teachers who work year-round 30 hours a week, they're going to be, that's easy too because they're just full-time employees. It's when you get to the teachers who might take 3 months off because your preschool is in session during the summer. I don't want to get that far in the weeds on this during this presentation, but there are some special rules based on guidance that was issued in January in regulations, and there's measurements and equivalencies that you use for these look-back and measurement periods that you need to focus on with if you have a population such as teachers who might fall into this close to 30 hours a week. So.
And what would you recommend in terms of further for getting further information about the special considerations with respect to teachers?
I would look to a attorney, an accountant, or another professional who could help you with those determinations, because it's really going to be a case-by-case basis. Unfortunately, there's not a flat-out rule that's going to apply to everybody.
Great, thank you. And then the other question that we have, unless Stephanie, you see any that we need to cover, is when we will be having a follow-up webinar.
Yes, we are sending out a survey after the webinar to ask some specific questions about what your specific needs for a follow-up webinar would be. So please take a few minutes of your very valuable time and fill that out so that we can create an appropriate follow-up webinar. We will do it as quickly as possible, but we need to hear from you first what your needs are. So please take some time to fill out the survey. And with that, I don't think that there are any more questions that have come in. I'd like to thank again Scott Bellin and Jennifer Mills and Amy Ogle for working with us to create this presentation this afternoon. We know that you may all have additional questions, so please take some time to fill out the survey so that we can address them. And if there aren't any other questions, thank you all for your time today. We hope that this was valuable, and I will say goodbye and wish you all a good day. Thank you.
Thank you, everybody.
Thank you.